Face masks, a safety meeting video on personal protective equipment brought to you by weeklysafety.com. Let's get started. Face masks and respirators are used to reduce exposure to airborne particles, droplets, and other contaminants. The level of protection they offer depends on the type of mask and, just as importantly, how well it fits and how consistently it is worn. Choosing the right mask and wearing it properly ensures it can provide the level of protection it was designed to offer. Fit and function. Every face mask works best when it fits securely over the nose, mouth, and chin. Gaps reduce protection and are often caused by the wrong size, poor mask design, or facial hair. A mask or respirator that is worn loosely, taken off frequently, or allowed to become dirty will not offer the intended level of protection. Whatever face mask you choose, it should be comfortable enough to keep on while performing your tasks. Cloth masks. Cloth masks come in many styles and materials. Higher quality options use multiple layers of tightly woven fabric and include a wire over the bridge of the nose. Cloth masks should feel breathable and should be washed regularly to stay clean. Avoid cloth masks that have gaps, vents, exhalation valves, thin fabric, or only a single layer. Wet or dirty cloth masks should not be used. Procedure masks. Procedure masks, sometimes called surgical masks, are disposable and designed to act as a barrier against larger droplets and splashes. When worn properly, they help limit what reaches your nose and mouth and also help reduce how much of your own respiratory droplets reach others. Because these masks fit loosely, they do not provide complete protection, but they can still be effective when used correctly and replaced as needed. Dust masks. Dust masks are designed for low-level, non-hazardous dust. They can help reduce exposure to larger particles created during tasks like sweeping, sanding, or handling dry materials. Because dust masks do not form a tight seal and do not filter fine airborne contaminants, their level of protection is limited. They should fit comfortably over your nose and mouth and be replaced if they become damp, dirty, or difficult to breathe through. Dust masks can offer basic relief from dust in the air, but they are not a substitute for a respirator when higher levels of protection are required. N95 respirators. An N95 respirator is designed to filter very small particles and achieve a close facial seal. When worn correctly, it provides a higher level of protection than cloth or procedure masks. The respirator must form a tight seal so air is pulled through the filter material rather than through gaps. Do not use an N95 that is wet, dirty, damaged, or difficult to breathe through. Proper use. How you handle a face mask is important. Remove it by the straps rather than touching the front. Once you remove your mask, be sure to wash your hands promptly. Never share face masks or respirators. Make sure whatever you wear does not interfere with your ability to perform your job safely. For any mask or respirator to work as intended, it must be worn correctly and consistently. Final thoughts. Understanding the differences between cloth masks, procedure masks, and N95 respirators helps you choose the protection that fits your needs and tasks. Remember, face masks work best only when they are fitted properly and kept in place on your face for the entire time they're needed. Thank you for attending this safety meeting. Consistency matters, so use your PPE the right way every time.